see there, it's pretty low. It's like 2 or 4 there, so you can pump it up this way. And then the little button on the side, releases the pressure. And these have a green section to tell you, what you want it to. You generally want it under 24 centimeters of water pressure, and that's where the green one is. You're usually going to set it like 20, 22. Make sure you don't have a leak. That's pretty much all there is to it. But there is also that minimal leak and minimal including pressure, and that one, you would get your stethoscope, listen over their trachea there. I really don't use minimal leak anymore because you don't want stuff leaking down into their lungs, but minimal occluding pressure, you would just, again, suction out the back of their throat first with the yank hour. You know what the yank hour is?
Yeah.
And suction that out, and then you're going to pull out till you hear a leak, and then just put air in until you hear no more leak. That would be minimal occluding pressure. So the minimal pressure necessary to occlude it. Minimal leak is you put in the pressure and pull it back till you heard a little bit of a leak. But you wouldn't do that anymore, just because we don't want the leak, down into the lungs. So minimal including pressure, just keep putting air in until you no longer hear a leak. But even if you did that, you'd always want to come back and check the cuff pressure. And if you don't remember what the cuff pressure is measured in, you just read it. It says centimeters of water pressure. So whoever does it, you say it's 24, and they say 24 what? Don't say I don't know. At least look at the manometer and see if you can figure it out first. And in your textbooks, it's going to say, it's going to give it as millimeters of mercury. Technically, you can go a little higher with centimeters of water pressure. People are always going to say like 24 centimeters of water pressure to keep it under. Once you say get up to 30 or something, you want to tell someone well, let's say I need like 40 centimeters of water pressure to keep this seal. What would a reason be for that?
The tube's too small.
Yeah, big ones, tube's too small, so you can put a bigger tube in. Or maybe the patient's starting to have problems, tracheomalacia or something like that. But generally, it's the tube's too small. So, with all of them, get your equipment, check. Well, this you don't need to check in order because you're just like a maintenance type of thing. But, wash your hand, get your equipment, wash your hands, tell the patient what you're doing. And with this, I would suction out the back of his throat and stuff first, just so he doesn't have anything down there. You can suction the endotracheal tube too, but all you're just going to put it on and, squeeze it up to get more in, and use the red button to, release it and they all have that green level where you want it. But really it's probably 24 millimeters of mercury, which in this is up in around 30 centimeters of water pressure. I think it's like, 1.36 centimeters of water pressure in a millimeter of mercury. So you got a little leeway with the 24 centimeters of water pressure. And generally I would just leave it somewhere around 20, 22. So you don't have a leak and nothing's going down into their lungs. Like, I think the pressure in your trachea to get blood flow is 25 or 30 millimeters of mercury. So you wouldn't want to be over that, because then you'd be including that pressure, and you wouldn't be getting blood flow through your trachea. But you definitely want to, make sure the cuff is sealed, and that's basically all you do. I would read through it. Does it say anything else on that little sheet you have for that? It's probably done. It probably says that, suction out the back of their throat, the yank out. A lot of times when you take this off, see how that's like 22? You might lose a little bit because it was filling up this palate fluid. When you put a pump on, it's usually a little lower. Clothes don't have a leak, all right. And generally you would check this every shift in a hospital, which would be every 8 hours. So if you're on 12-hour shifts, you do it at 7 a.m., 3 p.m., 11 p.m. Any questions on it? There's not much to it. Just put
it says verify seal by auscultating lateral neck. Is that when you check the minimal occluding?
That would be that minimal. So get your stethoscope on and put your. If you're just doing a cuff pressure, you can hear generally a leak. You can put your stethoscope on and listen if you want. But if they're on positive pressure ventilation, you'll hear the leak. So once you put the positive pressure breath in, you'll hear air coming up around the tube. For that minimal occluding volume, I'd get my stethoscope. I only have a syringe. I wouldn't have that. I put the syringe on. I'd listen, and say I don't hear a leak, so I pull back till I did hear a leak. That would be minimal leak technique, but we don't like to do that because we don't want stuff leaking down there. So then I would just put a little more air in until I don't hear a leak anymore. But I would still want to eventually find out what kind of pressure is in the cuff, because that pressure can include the vessels in your trachea, your trachea with that area of the eye.
So you do that and then check it with that?
Nope, just check it with this chip.
Oh, okay.
But sometimes you might intubate, and we put this in, and to tell you the truth, you're just going to fill it up with air so you don't hear a leak. But technically, you could listen over and make sure you have minimal occluding volume. As you put it in, just if they're 15, 20 minutes, a half hour with high pressures, that's not all that bad. You're going to go get your cuff mop. You're going to tape the tube, do all that stuff, then come back and check the cuff pressure. It should all be done within not much time. And like a code situation or something where they're putting the tube in, and you would just put air in the cuff, and know to check it afterwards though. But as far as this, there's not much to it. Just hook it up and make sure you squeeze it, put air in. And one of these is broke, so when you release the air, it gets stuck. So if it does, just push it back up. We won't use the broke one for confidence.